what is arthritis? To start, arthritis is a disease that causes damage in your joints. Right? So basically, all parts of the joints. The joints are places in your body where the two bones are made. So you can see that the common one we are aware of are actually the knee, the hands, the hips, the spine, and the foot itself, right? So it can affect anywhere in our joints. I think most of us will probably experience some form of a problem on the kneecaps. So knee is probably the most common places where the arthritis is affected. Okay, what are the types of arthritis? Arthritis can be broadly classified into two main groups. Okay, one is actually caused by the degenerative joint disease. So this group is actually due to the joints degeneration of the joint itself, and the arthritis that fall into this category are the osteoarthritis. In short, we call it OA itself. Another broad class of the arthritis that have inflammatory arthropathies, which means that they cause inflammation. So in this group itself, you'll find that the common one are the rheumatoid arthritis, our gout. Gout is also a types of inflammation arthritis itself, and ankylosing spondylitis itself. So there are actually more than 100 types of arthritis actually in terms of the sub types of arthritis itself. The common one I mentioned are the ankylosing spondylitis, which is actually the arthritis that affects joints near your lower back, especially at the back of the back. You can see from here on this picture, right? And of course, we have arthritis that is actually that affects the people who have psoriasis, right? So if you have psoriatic arthritis, and we also have arthritis that's actually affecting kids and children and teens itself, right? So we call it juvenile arthritis. So these are the more common types that we encounter. Now, how prevalent is arthritis in our world? All right, and basically one of the estimate data from US is that actually you can see from here, if you are younger than 65 years old, right, the prevalence of arthritis actually is about 30%, right, for both men and women. So 35% of the people between 18 and 64 years old will have actually suffer from some form of arthritis. Whereas for people who are above age 65, right, you can see that the prevalence of arthritis among women actually shot up to about 70%, and the men shot up to about 55%. So actually, arthritis is very, very common and is affecting women the most, especially aging women in there. Okay, now what are the symptoms? Okay, so in here we talk about, let's talk about two common types of arthritis we generally find. Osteoarthritis and rheumatoid arthritis itself. So I just run through here quickly just to let everybody know what's the two arthritis itself. There are different types of symptoms that we can actually differentiate the types of it. So, and it's important to know how to differentiate it because there are different treatment applies. That means that you'll find that later on the types of management strategy as well as the relevant supplementation for the arthritis differ by the types of arthritis you have. So in here, we look at the two types of common types of arthritis, osteoarthritis and rheumatoid arthritis itself. For osteoarthritis itself, the age of onset actually is older. As you get older, the incidence rate goes up because this is the degenerative joint disease itself. So we expect that the older you get, the more degenerated your joint will be affecting it. Whereas for rheumatoid arthritis, the age of onset can be quite early, 20 or to 40s itself. So can occur in younger person instead of older person. In fact, that is one of the differentiation signs. And the speed of onset of the arthritis is that for osteoarthritis, normally it is a very slow progression, right? It takes many years because it's a degeneration, gradual degeneration of the joints itself, right? But for rheumatoid arthritis itself, because it's an inflammation diseases itself, it can be quite rapid. The speed of onset can be from weeks to months, very fast. You can actually have the symptoms and onset. And affected joints, and this is a very important and a very easy but important differentiation between osteoarthritis and rheumatoid arthritis. For rheumatoid arthritis, because it's a systemic disease itself, right? So you very often occur symmetrical. That means both joints, the same type of joint, both joints occur. You have a symptom occur in the both joint, right? But whereas for the osteoarthritis, because it's a degenerative mechanical damage disease itself to the joint, so very often it's unilateral and limited to one set of joint. So in this case, very often it's the joint that have the withstand the greatest wear and tear, and in this case, usually it's the knee itself, and it's usually happen to the which one leg rather than both legs occur together, right? So the joint pain itself, okay, this is also one way to differentiate. For osteoarthritis, you know that it's a cartilage wear and tear in the joint, right? So therefore, the more you use, the more rubbing you will be, the you get worse. The pain will be more. Whereas in rheumatoid arthritis, the reverse is true. In fact, if you use it, right, the inflammation, you were able to reduce the inflammation. So therefore, it improves the pain, improves the usage. So this is also one way to differentiate between rheumatoid arthritis and osteoarthritis itself, right? And on top of that itself, osteoarthritis, because it's a localized joint problem, right? So you would not have symptoms that is affecting the whole body. We call it systemic symptoms itself. But whereas rheumatoid arthritis is the inflammation disease. In fact, inflammation occurs in every part of the body itself. So hence, for very often people who suffer from rheumatoid arthritis itself have systemic symptoms like fatigues and paralysis, right? So these are key differentiating symptoms, differentiating symptoms between the two main types of arthritis that you have itself. Of course, from the clinical perspective, right? We can also, based on blood tests, right? Looking at the blood test, the marker is a C-reactive protein or ESR marker, right? We can, based on that marker, to determine whether one is suffering from rheumatoid arthritis or not, right? So this is very important. I want to put it up front is because today we're going to talk about two types of arthritis itself, and knowing which type of arthritis a person is suffering from is important because it's relevant to the context of how we manage it. Okay, what is osteoarthritis? Let's start with the one that is actually most common, right? And osteoarthritis is the most common form of arthritis, right? So it's characterized by degeneration of joint cartilage, and underlying bone changes. So you can see from here that the big problem is that the joint itself, we always have a cartilage to cushion the movement itself. And this cartilage actually, because of wear and tear, so degenerated, so you actually have exposed the bones, and the rubbing caused the pain and caused the inflammation, right? So the key thing in osteoarthritis actually is the cartilage wear and tear, right? So as a result of wear and tear, rubbing, it causes inflammation, it causes swelling, it causes pain. Okay, how prevalent it is? Let's look at some statistics itself. Osteoarthritis on the knee accounts for 80% of the burden of osteoarthritis worldwide, which means that in worldwide, for osteoarthritis, knee account for 80% of the osteoarthritis, right? So of course, the arthritis also can happen in hips and in hand joints itself, but knee is the most prevailing one, which is understandable because knee is the one that have the heaviest load bearing of our body weight. low bearing cell. All right. So you can see from here, right, the progression or prevalence of occurrence of a knee osteoarthritis actually goes as we age, which is expected. As we get older, the wear and tear gets more severe, and therefore the prevalence rate goes up. In fact, at the age of 60, the prevalence rates for knee osteoarthritis worldwide is actually close to about 35%. Right? When at the age of 70, it's actually reaching about 41%. Now, the osteoarthritis, also the prevalence also different between men and women. You can see from here, women actually have a higher incidence rate, prevalence rate compared with men, right? And actually, the women suffer from osteoarthritis, especially on the knee side itself. Actually, the prevalence rate rapidly climbed above 50 years old and above. Right, so women actually in osteoarthritis actually suffer more than a man. Okay, let's look at some of the risk factor that affects osteoarthritis, and we look at risk factor that we cannot change. First, we know sex, women are higher risk than men for developing OA, and at the same time, age is also a risk factor. As you get older, your risk of having OA actually goes higher. You can see from here, the incline of the incidence for the females are much more steeper than the male self. Of course, family history of osteoarthritis also affects, contribute to your risk factor, right? If you have a family that first degree relative that have osteoarthritis, you do have a likelihood of developing the condition. In fact, this hereditary linkage is about 60 to 65% for hip and hand, right? And about 40% to 50% for the knee OA itself. Race also actually affects your risk factor. Asians have a much lower occurrence of OA of the hip and hand, but at a high, Asians have a higher occurrence of knee OA itself. So it affects by the genetic family history. It also affects by the race itself. Okay, what are the modifier risk factor? These are the factors that we can avoid. All right. So in the prevention, important is actually to look at modifier risk factor itself. So one of the important modifier risk factor is actually having a history of injury or surgery to the joint itself. Now, so this is particularly prevalence for people who are having sports like football, right? Where the contact of the legs and the knee are very often injured. And in this itself, people who are actually in the sports, especially on the football side or soccer itself, actually will run a higher risk of having knee injury and hence for actually have a higher incidence of OA in them, right? Also, on the occupation, your job itself, if your job involves a repetitive joint use, like carrying things itself on the joints, then you also will have a higher risk of suffering from osteoarthritis itself, right? So these two are the modifiable risk factor for osteoarthritis. Another modifiable risk factor for the osteoarthritis is your body weight. So therefore, we talk about obesity. In here, there's a two chart. It's very interesting to look at it itself because this chart of men on one scale is actually the probability of a knee OA in men, and this is the BMI, which is actually the body mass index. Of course, you can see from here when you are having low moderate activities, exercise itself, man doesn't actually have a risk of any knee OA, even the activities where your body is overweight. Whereas if men are engaging in a high physical activities, high impact activities on the knee, especially on the knee itself, then the risk of having OA on the knee actually increases as your body weight increases or BMI increases. So for men itself, right, if you are overweight and actually obese itself, right, you should avoid high intensity exercise to avoid stress on your knee. But you can take on moderate exercise to overcome a weight problem, right? So men have some leeway in here. Unfortunately for women itself, if you are obese or you are overweight itself, your risk of OA increases regardless of whether you are involving in moderate, low physical activities or high activities. So you can see from here that as long as you are overweight for women, your risk of OA, knee OA will go up itself. So therefore, in here, for women, reducing your weight is one of the key factors to preventing OA. But you cannot make use exercise as an option to reduce your weight in this case, because exercise will actually increase your risk of having an OA in this incident. Okay, what are the current treatment options for osteoarthritis? So there are currently no approved disease-modifying drugs for OA, which means there's no real cure for OA, right? The gold standard is pharmacological treatment by pain medicine. This is the current treatment standard itself. So you can see from here that we classify the OA pain into 3 categories. If you're having a mild pain, like we say, the pain medication is the solution. So very often the doctor will prescribe OTC medication like NSAID, aspirin, ibuprofen, right? Or if you for some reason can't tolerate or cannot tolerate or find that the OTC medication like NSAID is not effective, then you will have more stronger opioid, right, or CO2 drugs itself, right? But if your pain is moderate itself, there are options to deal with the pain. This is by injection, right? So unfortunately, by injection itself, or whether it's by steroid injection or lubrication injection, the pain relief is only for a few weeks. It is also not a solution itself, right? Where your joint pains are severe, then surgical options is the only option that actually for people who have severe joint pain, right? So you can go for realignment of bones itself if one side of a knee is more than the damaged more than the others, or you can go for a joint replacement. So actually, joint replacement is more of a long-term permanent solution for most people who have severe joint pain itself. A joint replacement, artificial joint can last normally about 15 to 20 years, right? Without problem. But of course, the joint replacement comes with the surgical risk of infection, blood clot, and so on, and infection, and so on and so forth, right? So these are the current treatment options for OA. Remember, there is no medicine that can cure OA itself, right? The treatment options actually are very often symptomatic relief of the pain. Okay, now let's look at what are the useful nutraceutical product or compound we can take in the absence of actually effective pharmacological therapy, right? There's no effective drugs. So therefore, a lot of us actually will turn to actually nutritional supplement, right? To also try to help to mitigate the problem or try to alleviate the problem itself. So in here, all right, I will list the 5 most common and clinically proven compound that's proven in effectiveness for osteoarthritis itself, right? Now, important is that we understand that the osteoarthritis, the root cause of it is actually the cartilage damage, cartilage wear and tear. So therefore, one of the key functions for the repair or for the treatment of actually the joint OA is actually based on cartilage repair function or capability. So in here, I have listed the compound, their effectiveness for the pain, all right, and also their evidence for the compound's function for cartilage repair. Right. So in here, you can see that among them, the top in the range of my recommendation is actually the UC2, undenatured collagen. Right. Undenatured collagen actually fare very high in the evidence for cartilage repair. Right. And it's also quite effective for relief of pain, joint pain itself. Right. So this is actually the top compound currently there's can be available for us to use for supplementation, followed by collagen hydrosate. And for the collagen hydrosate itself, okay, the evidence for cartilage repair actually is also quite strong and moderate. Its effectiveness for pain actually is moderate to high, so it's less effective than the UC2, but also quite effective in the consideration. The only problem is that for collagen hydroxylate, your dosage-wise, you have to take quite a high dosage per day for it to be effective. Whereas the UC2 itself, 40 milligram per day is a very good, very small dosage. But for 10 gram per day dosage is actually there's quite a high dosage to take. Now, the third compound that's actually proven in effectiveness for cartilage repair is actually the avocado soy. Actually, these are oil of avocado and soy combination. So we call it ASU, right? This ASU compound supplement, in fact, it's a mixture of oil or two oil itself, right? Also having evidence for cartilage repair, right? And it's actually the evidence are not as strong as the collagens, right? But it's also considered quite effective in one of the studies. Then followed by our non-common compound that we take for the osteoarthritis, which is glucosamine and chondroitin itself. Well, the evidence for cartilage repair on glucosamine and chondroitin are mixed and limited, right? But while they also do show some degree of pain relief, symptomatic relief for OA itself, right? So glucosamine and chondroitin is our fourth choice of compound of choice. Then followed by a compound we are very familiar with, it's called curcumin, which is actually turmeric. Turmeric extract is curcumin, right? Curcumin actually known for its high anti-inflammatory property, and therefore it is very effective for the pain. Unfortunately, the evidence for cartilage repair are not high in there. I put it here because that's the reason, because that while we are talking about repairing of cartilage, but pain relief is one of our consideration in OA as well, as you can see from the current treatment approach, pharmacological approach itself. Actually, the first line of treatment option is using pain relief anyway. So curcumin can be used as an alternative to the painkiller for some people. Okay, now osteoarthritis management. We talk about treatment, we talk about supplement that's suitable for osteoarthritis. But I think that in reality, we also want to consider what are the things we can do to prevent and also prevent the progression of the OA itself. So here are some of the guidelines. Reducing the risk of developing OA is first maintaining a healthy weight, right? We know the weight actually contribute to the stress on the knee itself and actually will exacerbate your OA conditions in the knee, especially on the joint weight-bearing joint. So engaging in a moderate exercise, we know that if you look at the chart itself, if you are obese, in fact, you have to be careful about having intensive exercise because it will also exacerbate your knee OA condition. Eating a healthy diet, right? This is particularly relevant for the relief of inflammation itself. And also in the diet, healthy diet is very often you also have the healthy oil and compound that can help to build your cartilage itself. Prevention of injury to joints. This is one of the risk factors I mentioned earlier. So therefore, if you are having injury to the joints or experience some injury to the joints, you need to get it treated as early as possible, prevent actually complication, right? So exercise regularly, right? And in this case, exercise that you choose should be exercise that's aerobic exercise, strength training, and flexibility exercise itself. So if you these are non-impact exercise on the joint, right? And these exercises are more effective strategy to relieve pain for patients who have also arthritis. So swimming is one of the best exercise for people who suffer from arthritis itself, right? Choose the low impact exercise, right? Walking are okay, are recommended, right? But don't go for jogging itself because it might have impact. Okay, and the prevention, another prevention is to protect your joints, and very often avoid joint overuse and repetitive stress itself, and then also try to maintain good posture in carrying weight, lifting weight itself. So these are very common sense practice, preventing injury to the joints itself. So if you're having osteoarthritis, please wear a supportive good footwear, right? Wear a pair of shoes that have very good cushion will help a lot in absorbing, and that will reduce the impact of your knee impact itself, right? And as I mentioned, manage your joint injury promptly itself, right? So this will reduce the risk of developing OA in the affected joint. Okay, now let's go to the other common types of arthritis, which is called rheumatoid arthritis. Now, rheumatoid arthritis is a very complex autoimmune disorder, right? So it is not just a disease of the joint. Basically, it's a disease of autoimmune disorder characterized by the inflammation of your joint tissue lining. So we call it synovium. Synovium actually is your joint tissue lining. In here, you can see that a healthy joint, the tissue lining is here, right? And in here, for rheumatoid arthritis patient, this tissue joint is inflamed, right? So this is actually caused by your body's autoimmune action, which means your body attacking trait that this film, this lining is actually as an external material, and therefore it's attacking it and causing it to inflame, causing inflammation. Yeah. And this inflammation leads to pain, swelling itself. And so very often, most of the time, if you are suffering from rheumatoid arthritis, you'll find that there will be swelling, there will be heat and pain in there together. Okay, how prevalent is rheumatoid arthritis itself? These are the Singapore statistics in here. You can see from here that actually in Singapore, rheumatoid arthritis, in terms of the inflammatory arthritis itself, rheumatoid arthritis account for 45% of the Singapore inflammatory arthritis. All right. The other 31% is count by gout, right? And the spondyloarthritis, actually the arthritis of your backbones, the spine joints itself account for the other 15%, and so on. So you can see from here that RA account for the majority of the inflammatory arthritis, right? And followed by gout itself. Okay, what are the symptoms? Well, RA is a systemic disorder, which means a disorder that affects the whole body, right? So it is characterized by inflammation and tissue damage in the joint, among others itself. So the first symptoms and sign usually is that it will happen in your small joint. Very often for RA patient, it will always happen in your fingers, your fingers and your toes itself. Most often, we actually will notice that the finger first. So your joint problem is start with the fingers itself. As it progresses itself, you will then actually spread to your waist, knees, ankles, elbow, hips, and shoulder, and so on. But in most cases, the symptom occurs in the same joint on both sides of the body. That means it occurs simultaneously on the same types of joint, both sides of the body. Okay, what are other systemic signs and symptoms for RA? Right, 40% of people who suffer from RA, right, have experienced signs and symptoms that don't involve the joints. What are the systemic symptoms? They suffer from anemia, which is actually low red blood cell. Fatigue. Anemia and fatigue are actually the same thing. Itself, basically, if you have anemia, the symptom of anemia is actually fatigue. You have fever, usually not the type of high fever, it's a low-grade fever itself. This is due to the inflammation of the body, inflammation, right? Loss of appetite, weight loss, muscle wasting. Basically, you find that you not only a weight loss, but also you're losing muscle itself. And then one of the symptoms common for people who have inflammation of blood vessel is the blue fingertips. You can see from this picture, right? So these are typical symptoms of inflammation of the blood vessel itself, right? It can be on the hand, it can be also on the leg itself, but very common, easier visible is on the hand side itself. How prevalent is it? Okay, now, unfortunately, unlike OA, which is actually caused by wear and tear, all right, itself, right? In here, the cause of RA itself, 60 to 70% of RA patients is caused by a genetic problem, all right? So gene become a risk factor. And this, unfortunately, is that if the gene is the one that causing the RA itself, right, then there's nothing much you can do with the gene factor itself, right? So in here, you can see from here, this chart itself, right? The prevalence cases per 10,000 population, you hear female, all right? As the age increases itself, actually have the higher incidence rate than the male itself on RA itself. So the peak is typically about 60 to 70 years old. At the peak itself, 70 years old, you see the peak itself, right? And females have a higher incidence rate of RA than the male itself. And unfortunately, the underlying cause is a genetic abnormality that is contribute to that. So for people who suffer from RA, right? If you look at it itself, you say, what are the causes? What do I do that I can cause RA? Reality is that actually 50 to 60% of the cause are due to genetic factor. Okay, environmental factor that can affect RA or increase the risk of RA are smoking, right? So in here, you can see from here that if you are a smoker, you are 2 to 4 times higher risk of developing RA compared with non-smoker, right? So about 20 to 30% of RA cases are attributed to smoking. So therefore, you look at it itself, half of the world's RA are due to a gene, right? Another 20 to 30% of RA are due to smoking. So smoking is one of the key environmental risk factor for RA. And if you look at here, the men have a higher RA risk on man smoker, than the woman smoker itself. Right, so therefore, for the men, right, although that on the sex side, you are at a lower RA risk, but if you are a smoker, then you have a higher RA risk itself, right? So there are other contributing factors in the environment, like silica dust and air pollution as well. A long-term exposure to air pollution also can increase the risk of RA, but smoking is the key risk factor, right, especially for the men, Okay, infection, right? There are 2 types of infection. One is actually the gum disease itself, right? Now, if the gum disease is known to link to RA, so that means that people who suffer from gum disease will have actually a higher risk of suffering from RA itself. And in this case, a prevalence rate about 1.86 times, which means that we have a risk factor of 1.86 compared to people who are not having the gum disease. So gum disease is actually related to your risk of RA. Another one actually is the EBV virus. This virus is a very common virus that affects all of us itself. In fact, almost all of us are actually affected, and sometimes in during our lifespan. I would say that close to 90 over percent of a human population are already affected by EBV virus. Now, this EBV infections is linked to a lot of diseases, but a lot of the diseases are related to the inflammatory types of diseases itself. For example, SLE, right, rheumatoid arthritis, multiple sclerosis, and also even EBV infection is linked to cancer like lymphoma and gastric cancer as well. So if we are, in fact, most of us are affected by this virus itself, and therefore this virus is a potential risk factor for us suffering from RA as well. Okay, what are the complications of RA? So we know first that the RA will affect our joint, so you will cause joint damage, joint deformity, right? So you can see from here that up to 60 to 70% of RA patients develop joint erosion between 2 years if untreated, right? And deformities occur in 30 to 40% of patients with long-standing disease, right? So put it that way, if you suffer from RA, you should get it treated, right? Now, if you don't, right, you'll find that you will suffer from joint damage and deformity. Of course, what you see in this picture here are the more extreme case of deformation. But when you are at this stage, then your hand is affected. Your hand movement is affected. Your function will be affected. So therefore, you never want to reach this stage anyway, right? Another one, of course, is that joint damage is one thing. Osteoporosis also can happen, right? That means 30 to 50% of RA patients develop osteoporosis. As discussed in our previous session itself, right? Osteoporosis, the complication of osteoporosis is what? Your bone fracture, right? So therefore, if you look at it itself, if you are suffering from RA and you have a higher risk of, as a RA, you suffer from osteoporosis. Osteoporosis actually will lead to bone fracture, and a severe form of osteoporosis actually will lead to a hip fracture. At least for instance, in this case, in 10 years' time, your risk of actually having wrist fracture actually is close to about 25% suffering from risk of wrist fracture if suffering from hip osteoporosis. Okay, one other complication. This is actually very common for people who suffer from RA, is actually having rheumatoid nodules. You can see from here that 20 to 30% of RA patients will have this kind of problem, right? So you find that the bumps of tissues around the pressure points of joints and lungs and so on. Very common you find in the fingers, right, and the elbow. These are the actually lumps of tissue due to rheumatoid arthritis itself. Eye diseases is one of the complications for people who suffer from RA itself. Very common, about 10 to 15% of RA patients will suffer dry eyes problem, right? And also 5 to 10% of RA patients will suffer from inflammation of the eye in here. So you can see from here that these are the symptoms of dry eye, these are inflammation in the eye. And also another 10 to 30% of RA patients will develop secondary Sjögren's syndrome. In this case, not only your eye is dry, Sjögren's syndrome also actually have dryness in the mouth, dry eye. So these are the common complications affecting the eyes for people who suffer from RA itself. Okay, now one of the complications that is not well known, but is very important and is relevant for RA patients in our management of it itself, is the psychological social impact of depression and anxiety. Right? In fact, depression and anxiety affects 20 to 40% of RA patients. Now, in here, in this study itself, right, you can see from here that people who are younger, less than 50 years old, 40% of the patients will suffer depression and anxiety. Whereas older people actually have a slightly lower incidence of suffering from depression and anxiety, but both are actually above 41% and 50%. So regardless of male or female, although female will suffer anxiety and depression, RA patient will suffer more, higher incidence than the male itself. But it is a very common complication, right? So depression is highly prevalent in this case, put it that way, right? So, and it also associates with poorer rheumatoid arthritis outcome. So if you have a depression, it affects you in many, many ways itself. So of course, certainly your outcome of the patient is going to be actually much more affected, the quality of life, right? So important for people who are taking care of RA patients. Please take into consideration the detection and management of depression for this patient. This is very important that you be aware, especially a lot of RA patients are now old people, right? Now, symptom of depression is almost close to 40% in them. And depression is a very debilitating condition, especially for old people, right? So do take note of the care regime itself must take care of actually management of depression for them. So how to manage depression actually is talk to them, let them socialize. At the same time, also let them actually have interact more with outside people. Go to a environment that's actually not enclosed. So these are things that you can do to help to relieve the anxiety and depression in patients that suffer from RA, because they're suffering from the pain, but that actually exacerbate the condition of anxiety and depression as well. Okay, now what are the important complications that from the perspective of actually prevention the patient from getting other diseases itself? One of the diseases that's associated with RA actually is the non-alcoholic fatty liver diseases. So we know fatty liver diseases nowadays is very common, but do we know that actually 1 in 3 RA patients suffer from non-alcoholic fatty liver diseases? Now, this is a very important finding, all right? And these findings are only recent, right? And therefore, it's important for people who are suffering from RA itself, right? Screen for non-alcoholic fatty liver diseases, because non-alcoholic fatty diseases itself, right? If you don't get it treated, right, it will lead to liver inflammation. It will lead to liver cirrhosis, right? It can even lead to death itself. So it's very important to actually detect the existence of non-alcoholic fatty liver diseases and actually get it treated. And remember that the RA patient have a very high, what we call incident rate of suffering from NAFLD or fatty liver diseases. So it's important. So in dealing with RA patient itself, now we have to actually add in important consideration is to screen for fatty liver disease. And if it's detected that is suffering from fatty liver diseases, get it treated. Itself. Okay. Another complication actually is the cardiovascular diseases itself, right? Actually, RA is associated with a 60% increase in risk of cardiovascular disease death, right? So now, unlike OA, I want to stand back and tell everybody. Now, we talk about 2 types of arthritis itself. Why I say it's very important to differentiate is because the risk of cardiovascular death is very high if you're suffering from rheumatoid arthritis. But if you're suffering from osteoarthritis, you don't have that risk. No, you don't have that risk. So that is very important. Why? Because in our dealing with people who have a risk of cardiovascular death itself, then relevant supplementation on cardiovascular diseases apply, right? So therefore, in here, it implies that, right, you can see from here that the risk of RA patient on heart failure and heart attack are much higher than non-RA patient in here, in this study itself. Over time, we can see the progression over time. The risk of RA are actually much higher, in fact, double the risk of non-RA patient for heart failure, also almost double for heart attack as well, right? So therefore, these are the complication of the RA patient. Okay, now risk of infection is another complication of RA patient. Now, RA is a very complex disease itself, right? And it's also a disease you cannot cure because you cannot change the genes factors itself, right? RA have 1.5 to 2 times higher risk of infection. Most notably, what type of infection? Respiratory infection. So people who suffer from RA, it's very important to prevent against infection of pneumonia or TB. In fact, this is one of the recommendations for RA patients is regularly, routinely screen for TB now. So if you are RA patient caretaker, do make sure that the RA patient go for regular screening of TB itself because they are susceptible to infection, especially respiratory infection. And RA patients who suffer from pneumonia, right, have a high risk of mortality. Now, like in the recent COVID, right, a lot of people say you have a RA, and an RA patient actually have a much more severe symptomatic problem when they contacted COVID, they actually have a more severe outcome itself. And this is the reason itself. All right. So another risk of infection is actually UTI. This is particularly relevant for women itself, right? So important is that UTI is a very important risk factor that need to be considered. And it might lead to sepsis in severe cases itself, we all know. So therefore, prevention of UTI infection is also part of the RA patient's management or care strategy, right? Also, a risk of infection on skin and soft tissue infection, right? Septic arthritis, this is a very severe case of arthritis that can lead to joint destruction and sepsis, which is actually life-threatening conditions, right? And also shingles, right? That means that you are actually more susceptible to shingles itself. So this is very common for a lot of people, and they ask why I get shingles, but maybe one of the reasons because you are actually suffering from RA, then you have a higher risk of it. Okay, now, what is the treatment option for RA? Now, unfortunately, as I mentioned, there's no cure for RA, right? But you should seek early treatment. This is the first line of advice, right? Don't think that you can deal with yourself. You should seek early treatment. Now, so far, how successful is the medical treatment itself? Put it that way, right? If you don't seek treatment, 25% will suffer disability within 7 years. 25% will suffer joint replacement within 20 years, right? Now, more important is that actually 50% to 70% will suffer structural damage, right, within 2 years. And, right, for severe case of RA itself, right, the 5-year mortality is 40 to 60%, which means 50% will die within 5 years. So this is the outcome if you let the disease progress untreated. All right. So early diagnosis and treatment of RA can avert the progression, and actually it can actually slow the progression of joint damage is up to 90% of patients. Right. So do seek treatment early, all right? Because 90% of patients at least can able to slow down the progression. Right. It's not a perfect, it's not ideal, but then it will help yourself. Right. Now, how effective? Currently, at least based on the first line strategy, right, of medicine itself, 40 to 50% of patients reach remission. This is better than no treatment. Right. This is better than no treatment. Okay, what are the management strategy? First, as I mentioned, there are no cure, but at least there are medicine as the first line strategy, right? They use steroid for short-term inflammation flare, right? Use painkiller for symptomatic relief of the pain, and you should consider natural adjuvant compound, which I would let you know after this slide. The next slide, I will show you what are the natural adjuvant compound that can be helpful in the pharmacological therapy itself. Now, also another standard protocol is actually that you must implement non-pharmacological strategy like physical therapy, physical exercise, and have lifestyle changes itself. But unlike OA, which actually have options like surgery and all the others itself, right? Most of the time, actually, for people who suffer from RA, the option currently is going to be on monitor and adjust treatment as needed, right? So as I mentioned, right, very important for regular assessment and testing and screening for TB and non-alcoholic fatty liver diseases. These are the two new findings of complication that we can detect and avoid and actually mitigate before it become major diseases for RA patient itself. Okay, preventive measure, lifestyle modification, which apply for both OA and RA itself. I can say that there's three component lifestyle. One is diet, low sodium, rich in fruits, vegetable, and omega-3 fatty acid and probiotic. Regular exercise, right? Proper exercise, especially those with low impact on the joints, right? But exercise for RA is also important because exercise for RA can also relieve the inflammation and the pain itself. And having adequate sleep hygiene and smoke reduction or cessation of smoking. We know that smoking is a risk factor. Okay, exercise is now important. I just want to focus. Exercise relieve the pain, right? So aerobic exercise actually is the solution for pain relief for people who are having joint problem. All right. So that means that you should have involved in low intensity resistant exercise itself, right? How frequent? Standard 150 minutes moderate intensity aerobic exercise per week, right? And then combined with some strength training exercise 2 to 3 times per week, right? So what are the types of exercise like swimming, cycling, as I mentioned, right? Now diet itself. Okay, here I just want to mention, right, while we talk about exercise, all that, there is a one type of diet that's particularly also useful or effective for people who are suffering from inflammatory arthritis itself. But this diet is only recommended for people who are obese and inflammatory arthritis, right? So the diet that is actually proven effective for obesity and inflammatory arthritis actually is called ketogenic diet or keto diet short, right? So I think that a lot of us here will be familiar with what is keto diet. Basically, it's a diet with high fat intake, moderate protein, and low carbo itself. In fact, usually the carbo is reduced to about less than 10% of calories, all right? So as far as concerned, keto diet is basically a suitable diet for short-term treatment of people who suffer from inflammatory arthritis with obesity itself, right? Do not actually jump into keto diet if you are not overweight, all right? Very important, I want to mention because there are some issue or concern on that, which I will not discuss in today's issue. But basically, it's a keto diet is suitable if you are fat, obese, and you are having inflammation diseases. Okay, now the key thing in here is that, all right, what are the effective supplementation we can take in the view that RA have no medical treatment currently, all right? So there are three key items here. Anti-RA compound, I put it, right? The top of the range with the strong evidence is curcumin or turmeric, all right? So obviously we know curcumin and turmeric has been very effective in anti-inflammatory function. So therefore, it's very effective for people who suffer from RA for the pain relief and symptomatic relief itself. So here, the best dosage is about 500 to 1,000 milligrams per day. Another compound, which is our familiar omega-3 fatty acid, which is a fish oil, right? So fish oil also actually have anti-inflammatory effects itself. but the dosage you need to take have to be quite high, right? Effective dosage so far in the study itself, you have to take up to 2.7 grams a day or 2,700 milligrams per day dosage for it to be effective. Then we have a third compound that have limited evidence in pain relief. We call it vitamin D. But I want to share with you one important thing about vitamin D as an important RA compound supplement for RA patients. Here is actually one of the reasons why I want to recommend vitamin D as one of the compounds. Right? Although vitamin D is not going to be very effective in the RA inflammation pain relief, right? It's anti-inflammatory, but it's not as powerful as curcumin. But in this latest study, this is a very important study itself, right? Which published in actually 2024, which is a very recent report that we find itself. The study find that there's a strong negative correlation between vitamin D deficiency and overall mortality in RA individual. You can see from here, right? This is a vitamin D level in the blood of the patient, right? And this at this point below, this means that the patient is having vitamin D deficiency, right? And this is the chart showing the risk of all-cause mortality, death, cause of death by the patient itself. You can see that the curve here is actually going up as your deficiency gets worse, right? So therefore, it is a very important consideration for RA patients, especially for old people of 60 years older, to go and check for your vitamin D status in the blood, in the body. And actually, it's important for old people who suffer from RA to supplement vitamin D, right? This is because it will cut down the risk of mortality in the individual, right? So this is a very important finding, right? So in terms of supplementation, although vitamin D might not actually help in your pain relief, but it actually does help in reducing the risk of dying, right? So very important consideration for people who are actually suffering from RA and it's your old age itself. Okay, now we talk about the product that's relevant to Atomy. There's actually for our today's topic on the joint. So we talk about, of course, we all know, Tomacin. Tomacin is actually the water-soluble form of actually polysaccharide of turmeric. Curcumin from turmeric itself, right? So this is a water-soluble form of extract of actually turmeric itself. So Atomy have this Tomacin, which is actually different from the turmeric essence extract that's from the market itself. But it's also this product is also have shown proven effectiveness in treating arthritis problem or knee pain. All right. So in here you can see that this product comes into tablet form of brown and white. The brown contains of turmeric extract plus uranium. The white one contains MSM, which is another compound that known to actually for the joint health itself, right? So the dosage itself, you have to take altogether 4 tablets, which is actually 2 brown and 2 white together per day. Okay, what are the applications of Tomacin? Right. Actually, there is a study talking about Tomacin. On this study itself, Tomacin actually based on the 4 tablets, 4 tablets per day consumption itself, right? It actually decreased the hazard of having shorter time to initial pain upon exertion. What it means is actually reduce the pain. Reduce the pain, all right, between less than 3 months of taking Tomacin, you have shown the effect of significant effect in pain reduction itself, right? So therefore, as far as concerned, there is a clinical evidence supporting the use of Tomacin in actually pain relief of joint itself. right? So relief of inflammation and pains, 2 tablets per day, right? Relief of arthritis symptoms itself, 1 to 2 tablets per day. It really doesn't matter. As far as concerned, if you have an arthritis problem, you take according to the prescribed 4 tablets, 2 tablets per day will be sufficient, right? Now, the upper limit of it itself, currently there's a study talking about tumorcin itself. 4 tablets of tumorcin per day will be actually the safety limit, right? This is about 2 grams a day, right? If you go beyond that itself, they might have incidents of some adverse event like indigestion and nausea, but these are not really a severe side effect to be concerned. So therefore, if you are suffering from RA or OA, actually taking tumorcin is a viable option itself. Now, one caution for people who are taking turmeric compound itself, right? Turmeric compound are contraindicated in pregnancy and breastfeeding. All right, so important. So you need to know that if you're pregnant or you're breastfeeding, don't take tumorcin, right? If you have gallbladder problem, bleeding problem, infertility, you're suffering from liver diseases, right? Don't take. You are going for surgery, don't take, right? So these are the precautions, right? So while taking the supplement, it might be helpful for RA, but if you are under this condition, please do not take, avoid taking it. Okay, another product that I want to mention here, right? Have nothing to do with curcumin or turmeric, but I think it will be very relevant for the pain, especially inflammatory related pain. It's actually noni juice, right? Noni juice is actually a very good juice that actually contains a wide spectrum of nutrients in there, and it is actually a very powerful anti-inflammatory juice, right? So one of the key noni juice function is actually improve joint health. Okay, increase physical endurance, increase immune activities, inhibit glycation of protein, aid weight management. Basically, it helps in weight management, maintain normal blood pressure, and improve gum health. So there's a wide spectrum of application for that itself. So therefore, as far as concerned, noni juice is actually relevant for whoever who are suffering from joint pain, muscle pain, joint pain, right? And also you are suffering from weight management problem. That means that you want to also control your weight. It's beneficial for people for weight management as well, right? So here are the study of actually noni juice for the treatment of gout. Gout is one form of inflammatory arthritis I mentioned earlier. So here are the results. I will skip it over, but just to show you that there is actually evidence showing noni juice is effective in inflammatory arthritis, relief of pain, right? Now, one of the key issue in noni juice is that noni juice have very high potassium content. You can see from here, the composition of noni juice is very high, about 3.9 grams per 100 grams of noni juice, potassium in the noni juice itself. So who should avoid drinking noni juice? People with kidney disease, right? And people with liver disease itself. Remember, so if you are suffering from liver disease or kidney disease, you should drink noni juice with caution. Do not overdose, all right? Now, what are the other consideration? Noni juice can have have drug interaction with high blood pressure medication, right? Important. So therefore, if you are taking high blood pressure medication with noni juice, please space at least 2 hours before drinking noni juice with medication, right? You are taking blood thinner, warfarin, right? So also do so. Make sure that you space. You are taking potassium water pills, sparing diuretics, right? This is also affected by noni juice. So these 3 types of medications, right? People who are taking these 3 types of medication, please space at least 2 hours before drinking noni juice, right? It's very important. Okay, that's the end of my session. All right.